I'm so jealous.
Bobby, I'm running out of the group.
All right, let's get started here. We are at 9 a.m.
On this lovely Wednesday, October 19th, 2022, I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call the roll.
Lewis,
Lewis here.
Shepro, Strathman,
Jeffro's here.
Oh, that's good.
Kepi,
Happy here.
Wallace, Silva, and Sanchez.
Sanchez present.
Strathman's online, I believe.
Yeah, I see Strathman online. I didn't hear. Cheryl, are you there?
Yes, Cheryl's here.
All right. We definitely have a quorum. If someone could please ask for unanimous consent to approve the minutes of September 21st, 2022.
So requested.
Shepro's here. Shepro requests unanimous consent. Any objections? Hearing none, the minutes are approved. Finance and budget, are there any questions on this month's Health Department financials? No, good, because Mr. Snowden isn't online, actually, I see. So we'd have to defer anyway. Public comments, is there anyone in person? I see none online either, so I'll take that as a no on public comments today. We'll move on to animal control. Brett?
Good morning, everyone. All my reports are on file. If you have any questions, please let me know, of course. And I do have a presentation for you today. Our last low-cost rabies microchipping clinic had occurred. I'm just waiting for it to pull up. I'm sorry.
Blair?
It's Blair's fault. Boy, the pressure's on, isn't it?
It was another very successful year. The people that come, the compliments we receive, how much people look forward to this, how much they need it, how much it helps them, and we get to help the animals at the same time. People love the drive-through style that we've continued to keep. It keeps the animals separate. It keeps the people separate with their animals. So it's actually worked out very wonderful.
They're pulling it up. There we go.
Beautiful. All right, perfect. There we go. Like I said, we continued to drive through style.
That's a
Yeah,
humor.
this is about right. It keeps the animals distanced. It keeps the flow of traffic moving. We do bring in a second veterinarian for this. And they're absolutely fantastic. Our crew, the staff is so wonderful because this is above and beyond their workload to do these clinics. And it's been absolutely amazing. We did another 6 clinics. We have found this to be our sweet spot. It gets us around the cold weather. The hot weather is a little easier because we have cooling stations we set up that have misters for the dogs. We pass out water to everybody. We have collapsible water bowls for the animals that the people get to keep. So it really has worked out just beautifully. This year's impact, the numbers did dip a little on the dog side, but as you see, the cat numbers continue to climb. And that's one of the hardest groups to really service, is getting people to understand that even their indoor cats do need your yearly rabies and microchip. Clinic totals, as you see, dog wise, we went from 388 was our peak last year down to 374, and cats going up to 98 has been fantastic. Part of this is due to veterinarians, hospitals being reopened, people heading back to their vets. We also did try some Facebook posts this year, and we'll continue to do that again next year to reach some of the areas of the county we weren't able to reach before. Here's our dog yearly comparison. And if we look at the numbers, one of the key things we pay attention to is that seniors number. Again, remember, seniors receive free tags in Kane County. So all they pay for is the rabies shot, which at this moment is $10. So 135 with our peak being 136 is really good numbers. And that's the group we really push hard. We have some wonderful senior communities in Elgin that we work with to make sure that those flyers are passed out starting at the beginning of every year so that we hit that group heavy. And again, our cat numbers rising has been absolutely incredible to see that the numbers this year, and again, 55 of those being of the senior community, has been amazing. And we continue to push the cats, and the drive-through has worked beautifully for the cats because they go right from the owner to us and back to the owner. Microchips have dipped a little bit. This was expected. you can only microchip an animal once in theory. So getting those numbers up close to 100 have been fantastic these last 2 years. We're really getting these animals microchipped in this county, which is going to help with relocating the owner should an animal get lost. And that's our biggest concern. We also do microchips at our facility year round. So above and beyond these clinics, we do microchips constantly. We use the mini microchips, which a lot of people feel more comfortable about because they're not as large as the standard. And people get very weirded out by needles. So to know it's a smaller needle and a smaller chip makes people very happy.
Question, Shepro?
Of course.
Mr. Shepard, I'll let him finish his presentation. We'll
Okay.
come back to questions. Thank you.
Revenue was up this year. Part of that is due to the change in fees we passed for 2021. It took effect in 2022. So part of that, although the numbers dipped, it kept our revenue up. But again, most of our revenue is fed back into the clinic itself because we pay all the staff overtime. We pay for water. We pay for those little collapsible bowls that people take, and we pay for the extra veterinarian. So really the clinic has started to basically pay for itself as we move forward. And that was all I had. If you have any questions.
Mr. Shepard, you had a question or comment?
Yeah, could you go back to the microchip slide, please,
Of course.
Blair? So is that the total number for the county, or is that what your office has performed? But that because I think it can be done by veterinarians as well, right?
Oh, yes, of course. These are just the microchips we have given through the clinic. The reason this is an important statistic is because, as you see, as Illinois state law actually mandates that your animal control facilities must do 2 microchip clinics per year, centrally located in the county or at our facility, which our facility actually accommodates both. So because that's a mandated rule, they also set the fee of $15. So we can't alter that fee in any way. I like to point out how many we're actually getting done at these clinics, because this is a perfect time where we have the people with us where we can explain the benefits of having the microchip. And one of the benefits of getting the chip with us is we do the first registration for you. So it's guaranteed that that microchip is registered to the owner that is getting that with their animal.
Got it. Thank you.
Of course.
Any other questions for animal control?
Yes.
Mr. Shepard?
There was some articles in the media recently about I think it was a few of the rescue shelter operators saying that they have seen an enormous increase in the number of pet abandonments, which they were attributing to the fact that many people apparently had acquired pets during the pandemic for companionship, I guess, indoor. And now that people are not feeling as confined indoors, a lot of those pets are being abandoned. And I wondered if that was something you'd seen, and if you would share the view that that's a disturbing increase.
You are 100% right. All shelters, especially in our area, are completely full with animals that are being surrendered back. People were very excited to clear out their shelters, clear out their animal hospitals of all these wonderful adoptions during COVID. But as people start to return back to work, our owner surrenders have spiked. We can't even handle them all coming in. A lot of shelters in the surrounding areas are in the same spot because we'll sometimes refer each other on to be able to take some of these owner surrenders. And we've heard from them that they can't take anything. So we can't even suggest them. People have just been surrendering in high numbers. Plus a lot of these rescues and shelters have brought up other pets to fill those spots. And now they're getting their pets back, which is making things a lot worse. So yes, shelters have filled up very quickly as people are returning back to the workforce.
I think Mr. Kenyon has some space. Maybe no. No, sorry.
No, I just, I understand.
Mr.
Ms.
Chairman,
Bates. Ms. Bates, and then I'll come to you, Dr. Silva.
thank you. A lot of people, friends of mine, think that if they have a dog, they have to have 2 dogs to keep each other company. And which puts a burden on a family to have 2 dogs instead of 1. So I'm wondering, is there any data about the health of a single child dog or versus having two? I don't know if anybody's done that study, but it does put a burden on a family if they feel like they have to have two dogs in the house. So I'm just wondering if there's any health data about one dog or two.
Animals are, dogs, excuse me, are pack animals. So they need a pack, and you'll get a lot of people that feel that the animals need to keep the pack, forgetting that us as humans become part of that pack. And a single dog in a home does completely fine as long as the people have time for it. It's the people that go, I don't have a lot of time. If I get a puppy, I'd like to have a second puppy, which makes sense because then that animal's health is going to increase having the second animal to be part of that pack day in and day out versus the single family that has a little bit more time for their one animal, then it is part of that pack. So it is because the dogs are such pack animals and follow that pack mentality, that's where people get the, well, I have one, I should get two. It's like, well, I already have two cats. What's a third? Well, next thing you know, we have a hoarding situation. So what I tell people is what can you afford comfortably in an emergency if both animals were to get sick? And that's where you should look to expand your family.
It'd be a better pack.
Yes.
Okay, thanks.
Dr. Silva, you had a question?
Yes, good morning. Question, more of a statement. I am an animal lover, and though I haven't made it to King County Animal Control yet, I do tend to go to the local animal shelters sometimes and donate. And one of the things that I can attest to is that they are very, very full, and it is a very sad situation. And I won't name names, but I've seen the animals lying on the cold floor with lying in their own feces and urine, which is really sad. And I'm heartened by the fact that I know that that's not the case with King County Animal Control. So it is a big problem, I think now. So somehow we should increase our marketing for adoptions if that's possible. And the other thing I was going to say is the only thing I have seen is that I have seen a shelter ask that if you're adopting kittens, that you do take at least two, but I haven't seen anyone ask for two dogs. I've just seen two kittens. Thank you.
Correct. A lot of places to help move cats will do that because having one kitten, a second kitten, they play very well together. But there can also be issues in that. Going back to the donation, if anybody has the ability to donate to your animal, local rescue shelter, whatever it is, it doesn't matter. It's very vital to these animals. And we had a situation recently in Campton Hills, and this community stepped up tenfold to help us restock our blankets and towels and everything to take care of these animals. And it's these moments where, yes, they're difficult on my staff, but to see the county as a whole rise up to help these animals is absolutely incredible. And it just is the reason I do this job and how much I love working for this county.
All right, any other questions or comments for animal control? All right, thanks, Brett.
Thank you.
Appreciate it. All right, next up, Mr. Isaacson, Health Department updates.
Excellent. We have a brief presentation this morning as well. Good morning, everyone. Just first want to start, thank you, with a little information about COVID. So our average number of cases that we're seeing each day has continued to go down. So you can see over the past month, we've averaged 64 cases reported to the health department each day. If you remember a month ago, we were averaging for the month 121 cases per day. So that's continued to go down. Our average number of cases over the past week is about 62, which means even though cases are going down, they're not going down as quickly as they were before. And again, we always like to add the caveat, these are the cases that are actually reported to the health department. So with home testing and things like that, we know there's a lot of COVID activity going on out there that we're not hearing about. Do want to mention that we do have bivalent booster shots available for everyone 5 and over. So this really is helpful to keep people from getting seriously sick from COVID. So the number of people who are eligible for the new booster that have actually gone out and gotten it is quite low. So we still want to encourage people to get it. And even though Kane County is now what the CDC considers low, so we're in the green. Most of the counties in Illinois are in the green. Winter is coming, and we're getting back inside and with friends and family. So there's fear that there could be an increase in COVID cases. We're seeing some countries in Europe that are having pretty sharp increases right now. And then some states are seeing an increase. So get your shots and just take precaution. And then if you have been exposed to somebody, certainly, if you yourself have COVID, please stay home and isolate per directions. And then if you've been exposed to somebody, we ask that you wear a mask for 10 days. Going along with that, influenza, we're coming into flu season in the Southern Hemisphere. They saw a pretty hefty influenza season. So we do have some concern that we could have quite a bit of activity here. Also, again, as I mentioned with the COVID, now that we're back with each other, we've had 2 years where we've had pretty low flu activity. So we expect to see that increase. But again, the good news, we do have vaccines that are very good at keeping people from getting seriously sick. So we encourage everybody to go out and get their flu shot, and you can get your flu shot and your COVID shot on the same day. So go out and 2 birds, 1 stone and get that taken care of. Any questions about either one of these things?
I see you are wearing a mask.
Ms. Bates.
Oh, thank you.
Identify
Ms.
for the
Bates,
record, yeah.
Thank you. Are you recommending people will start wearing masks?
No, I actually have just been exposed to someone, so I'm just following directions. Yes.
Leading by example.
Thank you.
Any other questions on this portion? COVID?
So something a little more fun than COVID and influenza. We did have International Walk to School Day last week. So we had about 80 schools that participated. If you go to the Making Kane County Fit for Kids website, you can see tons of pictures from all over the county. This is always a really positive way to get out there and promote something that is positive, getting people out and physically active. So with a couple of down years with COVID, again, I think this is just something great to see people getting back to normal and getting out there. Knock on wood, we enjoyed some decent weather on that day. So that's always a blessing when it's not pouring rain on Walk to School Day. So just something fun. And again, getting kids active is something that we actively promote, with chronic diseases being one of our key priorities that we try to address. And just as a reminder for people who may not know, the health department launched Making Kane County Fit for Kids a little less than 15 years ago. A few years ago, we spun it off as its own 501c3. So now the health department is a board member with several of our hospitals and our Division of Transportation and the United Way. So just a really positive way that we push funding out. And there is grant funding available from this organization to community organizations to do things to improve access to healthy foods and physical activity. I always like to highlight new team members. So we have successfully brought on a new environmental health practitioner and a new nurse, which we're thrilled about. So this is Julia and Yolanda. Excited to have them on board. So far in the last few months, we've had 1 retirement and several hires. So fingers crossed, we're filling our empty positions and able to serve the public better. So thrilled to have these folks join our team. And now we want to transition and talk about behavioral health. So today we're kind of officially launching our Thrive by 2025 initiative. And I've talked at length with the board about the impact of behavioral health on Kane County residents. So I'm not going to spend a lot of time getting into the statistics today, but we have seen increases in suicide. We have seen increases in fatal overdoses. We're seeing increases in behavioral issues in schools. We're hearing from the public that they're really struggling. This is the #1 priority that was identified in our last community health assessment. So, this is how we wish things work, that you have a problem in the yellow box, you do an intervention, and then you get your outcome, right? So, okay, we're losing our friends and family to overdoses. Well, let's just have a simple intervention and then we can reduce that. Or we're losing people to suicide. Let's have a simple intervention and then we can reverse that. But in reality, this is how things really look. So why are we losing people to overdoses? Well, we have a massive amount of cheap fentanyl that's being manufactured in China that's getting into our country. We have heroin that for many reasons has been made cheaper and cheaper over the years. So it's easier for people to get and access. We have overprescribing that's occurred over the past decade. We have people struggling with trauma that they may have experienced earlier in their lives. So they're self-medicating. So all of these complex things that go together. So it's never as simple as just having one intervention. Going from the purple box to the blue box doesn't work because there's all these other factors that are going on. So with this Thrive by 2025 initiative that we're launching, what this is an opportunity to really acknowledge how complex these issues are. So the things that impact mental health of our residents, they're complex, they're interrelated, they're different for different people. So we can talk about a 16-year-old in one community who may live in a violent home and have exposure to gangs and maybe can't find access to services in their neighborhood. That's an entirely different set of risk factors than maybe somebody who comes from a more affluent home, but maybe has access to different drugs or has different pressures in life that may still lead to something that could cause tremendous harm to them, either just through suffering with mental illness that's not being taken care of, or ultimately with something like suicide or an overdose. And then as we've talked about at length, these last few years have really exacerbated all of these problems. So I just threw a few terms in the orange box there. Just some of the things that people have dealt with: alcohol, anxiety, bullying, child abuse, community violence, domestic violence, fear, just the uncertainty of whether it's the uncertainty of what's happening with the future of the country. There's so much fierce dialogue that people are being exposed to now, fear of COVID, whatever it may be. Certainly the presence of fentanyl, isolation, loss of loved ones, mental illness that's not being treated, or being around someone who has mental illness that's not being treated, especially if that's your primary caregiver, living in poverty, experiencing racism, substance use, again, not only for the individual, but if it's a caregiver, that has a dramatic impact on the children they're raising. Transportation, specifically lack of opportunity for transportation to get to needed services, and then other kinds of trauma that people have experienced. So it's a lot of complicated things that fit together. So what this Thrive by 2025 is creating a multi-year plan for our community where we have a unified vision across existing efforts. So no one organization can address these things. No one coalition can address these things. But what we're hoping to do with Thrive by 2025 is bring together the existing efforts and find commonalities where we can work together so that we're mutually reinforcing with what our activities are. I've talked a lot about community engagement, and I'll talk about that in a next agenda item as well. But any successful intervention has to have people involved. It has to have the public involved. It can't be officials or the people from the ivory tower coming into a community and saying, here's what you need to do to fix yourself. That has shown around the world not to work. You need to have people in each community. And again, this impacts every community in Kane County. They have to be involved. Trauma is a key piece of this, and what people have experienced has a lifelong impact on them. We need to be able to measure the impact, specifically looking at disparities, but just in terms of measurement. And this again is something that's a key for me at the health department, is we need to get better at not only measuring progress and looking at outcomes, but also being able to provide more data to organizations. For example, we just presented to a 708 board last week, and it's tough for us to pull some of this data together. So we need to increase our ability and our capacity to get information about what's impacting people's mental health. A key thing for this is supporting existing efforts. So Thrive by 2025 is an effort that's meant to support what's happening in the community already. We'll identify gaps. We may start with some new things, but we want to work together with the state's attorney's office, with State's Attorney Mosser's efforts to reduce domestic violence, with pre-arrest diversion programs, with Sheriff Ron Hain and some of the innovative things that he's been doing around job training and reentry and helping people to stop using drugs. We want to work with the Family Violence Coordinating Council, the Kane County Juvenile Justice Council. We, through the health department, manage a behavioral health council and an opioid task force. All of these groups and more are working in this space on specific things to try to make life better for people. But we can't do it alone. So this is going to be a way for us to support what others are doing so that hopefully it lifts all of us up. So as I mentioned, it may create new opportunities. It'll definitely attract new resources to our community. You can imagine when we roll this out, where we have this unified plan for our community, any organization that's writing grants, then this is going to be very strong in their grants to be able to say, look, we have this plan and our school districts have all signed on and endorsed it. Our city councils have endorsed it. The county board has endorsed it. We're all together on this, moving in the same direction. That's going to make us very appealing to funders. And again, across a wide range of things. So we could be getting new money from the Department of Justice. It could be looking at new money from health departments or human services, the state health department, I mean. So lots of opportunity and certainly engaging a broad range of stakeholders. 5 key questions we're asking, and this is based on all of the work that we've done so far. What do we need to do to support the workforce? So that includes not only the issue that everybody's struggling with across the country right now is how do you recruit and retain skilled people, but also what training is needed. What are the interventions that our people need to do? And this could be law enforcement, this could be schools, this could be mental health professionals. This goes, again, a really holistic view, but what do we need to put in place as a community so that we can support people so that our residents are getting what they need? Then looking in what are the strategies that we need to really be able to support families and individuals. So I've talked before, if a 16-year-old needs therapy, that's great. And that's an intervention that may be really important. But if that 16-year-old is also still struggling with school, if they're also maybe living in a home with violence, they also have friends who are using drugs or gang involved. If we don't address those things as well, just the therapy we know is really challenging for that to make the difference that we want it to make. So this is going to be a way that we can really wrap around and provide more access to people. Coordinating across sectors, I've been speaking about that the whole time. Looking at specific populations. So this is not only looking at where there may be disparities, but as I mentioned, a young person who may come from a family that's more affluent still has needs that may be different from somebody who is in a different community. And we need to look at all of those to make sure that we're protecting people as well as we can. And then finally, and I think this is equally as important, but one of the more challenging areas because of the complexity of all this, we have to be committed to being able to track and show progress. So we have to show where are the risk factors, where are we showing improvements, and so that we really can drive resources. And when we allocate resources to help, that we see that it's actually making a difference. So just a quick timeline. So we're kicking this off. I'm kicking this off today. Over the next few months, we're going to be meeting with these individual organizations. And again, this is something that I've already been working on since about January, working with key stakeholders in the community, but now we'll formally work with these groups to identify solutions to those 5 questions before March and April. Excuse me, we're going to get back together and consolidate and finalize our strategies, and then formally launch this plan in 2025. So one key point I want to make with this slide, there's work going on this whole time, right? And that's what I want to make clear is this plan is pulling together our resources and lifting everybody up, but this plan isn't just the work. So between now and May, all of our groups are going to be doing interventions and are going to be working on things and are going to be testing things to see what's working the best, to see where we're getting the most kind of return on our investments. So even though this is going to take about 6 months or so to get this out, I will be providing regular updates on progress so people can see how things are going. And then in May, we're going to have our formal document that we're going to go around and start asking organizations to sign on and endorse. Why 2025? Because certainly we're not going to solve all these issues by 2025. We just wanted to do this just to give a sense of urgency to it. And as we've talked about working through the pandemic, there's a lot of issues that people are struggling with now. So this is to put energy on it. 2025 is not the finish line. That's just so that we really, like I said, give it urgency so we can get things started. I want to thank the people who've been on the planning team so far. So you can see their names on the slide. So we have a good cross section of people from behavioral health and early childhood work and the criminal justice system. Also have been working with elected officials, faith leaders, many others who've been involved and are committed to participating in this. So I'm really excited about this. I think this is going to be a really big initiative. And again, this isn't just the work itself. This is how can we support and lift up all of the other work that we have going on. So I think, I don't know if I'll maybe pause for questions if there's any now.
Does anyone have any questions on this initiative? No.
Well, how are you picking your partners and stakeholders?
So we're opening it up to anybody who wants to participate. So there are multiple coalitions that already exist. So as I mentioned, just through our office, we have a behavioral health council that's pretty broad-based. We have an opioid task force. So those are two specific areas. Within the county, we also have the Juvenile Justice Council, which really is looking at young court-involved people. There's a group called the Family Violence Coordinating Council that works through the state's attorney's office that already meets regularly and has different initiatives that they have going on. There's multiple early childhood initiatives in our community. So the health department has one called the AOK, All Our Kids Network, where we have social determinants of health, and trauma is something that we're really focused on. And that's really where we launched our IRIS referral system through. But then there's also a network called Spark in Aurora, Elgin Partnership for Early Learning up in Elgin. And so again, all of these things, it's so complex how they all fit together. So anybody who wants to participate in this, there's a way I think we can fit people in.
I just want to say thank you. This is a great start. I thought you picked 25 because it rhymes with thrive, but
Well, yeah, I'm simple. So yes, that's part of it.
thrive by 25.
Mr. Chairman?
Dr. Silva.
Thank you. So would there be, where could we access information on the meetings? I'm assuming some of them are.
We
He
can't
has
hear
Zoom.
you, Dr. Silva.
Can you hear me now?
Much better.
Okay, thank you. So my question is, I assume that many of the meetings or some of the meetings are held via Zoom. And I'm wondering if it would be possible to have access to a list of meeting dates so that we can be guests and participate as much as we can, but also to have a broad spectrum of information so we can connect the dots when we make these decisions on the board. I would love to attend as a guest some of these meetings. And then the other thing that I was going to say is that let's not forget that wherever you lie on the issue, we do have an immigrant population in the area, and so many things. There's many issues with trauma related to immigrant communities, particularly the parentification of children who are not made to. We've done it willingly, but who interpret for parents, who kind of function in the role of a parent because sometimes our parents don't speak the language, or there are many other issues. So let's also take a look at the trauma associated with immigrant families, with families who perhaps might not be fluent in the language and those sorts of issues. But back to our meeting times, if we could get information on that, that would be wonderful. Thank you.
Excellent. Thank you, Dr. Silva. And the points you raised, I'll certainly share meeting information. I think that's excellent. The more participation we get from the board, I think that's very helpful. And then to your points about our friends and neighbors who are maybe newer to this country, we certainly want to be mindful of the unique issues that may be facing families there. And again, whether it's related to trauma, whether it's related to you use the example of having family members translate for other family members, which we try to avoid as much as possible, just for privacy and things like that. But transportation issues, language issues, isolation issues, yes, all of that we need to address. Thank you.
Ms. Bates?
Then maybe World Relief would be a good partner for this
Definitely.
project.
Absolutely.
Any other questions or comments? Mr. Tepe?
I have some questions that don't relate to the Thrive by 25. So, anyway, but this really looks great.
Your mic's not working, or pull it forward.
How are,
Mike is not on. So you're not on.
is this better?
There we go.
Okay.
There we go.
As I said, I've got a couple questions that don't relate to Thrive by 25. The key thing is the two questions are, one, how is the IRIS program continuing to go, and what's the acceptance and the effectiveness of the IRIS program?
Yeah, actually, good timing for that question. We have our quarterly meeting coming up on Monday. So I will resend that information to everybody. So if you want, you can actually see the full update. But we'll make a recording of that available. So we'll share that link. But we have over 140 partner organizations. So we've had well over 1,000 referrals. And again, we're making this broader and broader all the time, so that when somebody at an organization interacts with an individual or a family, instead of just being able to provide what they need, they can give them access to a variety of services.
Yeah, I've heard nothing but accolades about the program, but I want to make sure that it's, it's one of those kinds of things that you need to continue to promote, but, not promote too aggressively, just effectively. But, they find it very effective to be able to refer people to other services. Okay. And second, there's a meeting that you used to conduct every 2 or 3 months with those supporting organizations. Is that all continuing? And
Yep.
okay.
And I'll share that information with this committee as well, so we can see all the different.
Thanks.
All right, any other questions or comments? All right, was that the end of your presentation, Mr. Isaacson?
One more slide.
Okay.
So opportunities to engage residents. This is something when I was interviewing for this position that I identified as a key issue. And this is something that I'd like to move our organization to do much more of. This is a photo from a community council that we had in Aurora several years ago. This was part of a grant initiative. This, I think, is some of the most rewarding work because, again, without really engaging the residents and finding out what's important to them and having people part of the solution, it's much harder to get things to stick and have long-lasting change. So what we're going to be rolling out is some initial input sessions where we can just hear from people. And it may be something where, this is more akin to like the focus group where maybe somebody just wants to share their ideas once, talk about what's going on in their community. And again, this is something, and kind of the tagline we used with this previous experience was every voice matters. We want to hear from people. We want to know across the spectrum of our residents, what's important to them and what do they think we should be engaging in with health. Certainly we do this as part of our formal community health assessment process. What I'd like to move us towards is, instead of doing it once every 3 years, this is something that we're doing more continuously. So I'd be interested in talking with board members about opportunities potentially in your district. If you have events or things already going on that we can partner with, I think that would be really helpful. Number 2, moving on from that, would be establishing a resident council to start with. And I put the plural in parentheses there, that maybe it's something that we have more geographically spaced, where we have residents that are on an ongoing group. So rather than just giving us their input once, we would have people that I could hear from on a regular basis. And this would create a forum, again, not only to hear what's important to the people, But also when we're launching new initiatives, this is a way to kind of keep us honest and for us to get really good feedback. So something as simple as, hey, here's a new flyer that we've put out. What do you think? Does this resonate? Is this a way that we're going to be able to communicate with people in your neighborhood to get that kind of feedback? But also, hey, how come you haven't come and offered vaccine in my neighborhood? Or, hey, the mental health services or the transportation issues in my neighborhood aren't what I think they should be, where we have a forum where we can hear from people. And again, this really keeps us honest and I think gives us an opportunity to be much better. So it may be some things where we're getting, criticism is too negative a word, but we're hearing about gaps at the beginning. But by hearing that open information, the gaps exist, whether people are telling us about them or not. So we can engage in that open, honest conversation and empower the public to really be part of it. I think we're much more likely to make lasting change. So right now, I'm kind of waiting a little bit for the election because these are not just about the big election issues. This is about what's going on in the community. But I'd love to engage with any of you to see over the next couple of months if there's something in your district, especially for that number one, to have some input sessions so we can hear from people. So thank you.
Ms. Bates?
Thank you. Mavis Bates. When I knock on doors, I've knocked on thousands lately. One of the issues I come up against is that Kane County does not have a place where someone in crisis can go for like a retreat, like a cooling tank, which is retreat sounds better to me. I've been told by my constituents that they have to take their loved ones to Kendall County to get this kind of a service. I don't know much about, I don't know what I'm talking about exactly, but I know what I hear from my constituents. Is there any vision that will be offering a care like that, a retreat or something like that?
Yeah, and I think something like that is potentially something that's going to be supported by the Thrive by 2025 initiative. We do have a relatively new crisis stabilization unit that Ascension Mercy Hospital operates in Aurora.
There's my word.
So yes. So that's excellent. It's just starting up. And of course, I think they're struggling with the same staffing issues that all of us are, but that's a tremendous resource. We're looking at another crisis stabilization unit managed by the Ecker Center up in the northern part of the community. And actually, we've got a call this afternoon. There's some discussion about something mid-county that may be in the works. So that's a tremendous need somewhere between hospitalization and doing nothing, where you can just get somebody in and we can kind of help them out at kind of a step down level. I think that's very important.
I think that's very important. I mean, I've had people crying at the doors when I knock on the doors.
Yes.
So thank you for that.
Yes, excellent. Thank you.
Any other questions or comments? Okay.
Thank you.
Is that it?
That's it.
Okay.
That'd be it. Well,
There's usually a questions or comments
yeah, sure.
slide.
There you go.
It's just- yeah,
Comments
okay,
or
I was waiting
questions?
for
There
that.
you go. There you go.
That's my signal. I'm like a trained dog. so. All right.
Well trained.
Well, if there is nothing else from the committee, we have no old business. Can someone ask for unanimous consent?
Mr.
to
Chair,
place
Mr.
reports
Chair.
on file?
Mr. Chair, I'd like to put forth a unanimous motion to place reports on file.
Hearing no objection, the reports are placed on file. No need for executive session as always. No new business today. No public comments on non-agenda items. And I just need a motion to adjourn.
Chair, I'd
Motion
like to move
second.
to adjourn.
Pepe,
I'm not a member.
Kenya's not on the committee.
It's extra credit.
Second, from somebody.
Strathman.
Strathman seconds. Thank you, Cheryl. All those in favor say aye.
Aye.
I
We are adjourned. Thank you for
Aye.
being here.
to adjourn.
Step row, aye.